Axial skeleton. The skull, vertebrae, sacrum, coccyx, hyoid, sternum, and ribs. Cervical. Looks like a fox head. Spelt Cervical. Thoracic, Thoracic. Looks like a giraffe head. Lumbar, Lumbar. Looks like a moose head. Coccyx, Coccyx. Tailbone. Hyoid, Hyoid. Is above the larynx, not connected to any other bone, looks like lower vampire teeth. Sternum, Sternum. The top of the sternum is the manubrium, Manubrium. The middle is the body, and the bottom point is the xiphoid process, xyphoid process. Ribs. Sharp edge goes down and the sharp turn goes to the back. Appendicular skeleton, upper. Scapula, clavicle, humerus, radius, ulna, carpals, metacarpals, phalanges. Scapula, Scapula. The shoulder blade, the ridge in the back, and the cup to the outside. Clavicle, Clavicle. Your collarbone. Rough part goes down, smooth side goes up, most frequently broken bone. Humerus. The head goes up and the little ramp goes down. Radius. The radio button goes up, the lump goes up, point goes to the thumb. Ulna. The flat piece goes to that side of the body. Carpals. Starting with the thumb. Scaphoid, Scaphoid. Lunate, Lunate. Triquetral, Triquetral. Pisiform, Pisiform. Trapezium, Trapezium. Trapezoid, Trapezoid. Capitate, Capitate. Hamate, Hamate. Metacarpals, 5 of them starting from the thumb side. Phalanges, Phalanges. Proximal, in close proximity. Distal, furthest distance away. Intermediate, middle. Appendicular lower skeleton. Os coxa, femur, patella, tibia, fibula, tarsals. Os coxa, Oscoxa. The top of it is the ilium, Ilium. The middle is the ischium, Ischium. And the bottom is the pubis, Pubis. Femur. Head goes into the hip and the curve goes back. Patella, Patella. The Apex point goes down, concave side goes to that side. Fibula. Slope goes to the rear, rough goes to the ankle. Tibia. Bone that sticks out goes to the front, hook goes inside. Sacrum. S-A-C-R-U-M. In between the hips, tailbone connects to it. The peritoneal cavity breaks down into the parietal peritoneum, which lines the cavity, and the visceral peritoneum that lines the organs. The abdominopelvic cavity breaks down into the abdominal cavity and the pelvic cavity. Pleural cavity breaks down into the parietal pleura, lining the cavity wall, and the visceral pleura, lining the lung surface. Pericardial cavity breaks down into parietal pericardium, lining the cavity wall, visceral pericardium, lining the heart surface. Thoracic cavity breaks down into the pericardial cavity with the heart and the pleural cavity with the lungs. Superficial membranes, duramater, subdural space filled with interstitial fluid. Arachnoid, subarachnoid space filled with cerebrospinal fluid. Palmator, brain spinal cord, deep membranes. Hypochondriac, meaning below the cartilage. Belly button, also known as umbilicus. White blood cells. Neutrophil, lymphocytes, monocyte, eosinophil, and basophil. Neutrophil is 60 to 65% of white blood cells. Is the first responder in tissue trauma. The lymphocytes, 20 to 25% of white blood cells, with red blood marrow for antibodies and lymphocytes to help with immunity. Monocyte, 3 to 8% of white blood cells. Eosinophil, 2 to 4%, and basophils, 0.5 to 1% of white blood cells. Blood, 45% formed elements or cells, and 55% fluid humoral portion or plasma.